Hello everyone. Today we will be diving into the genetic disease of hemophilia. Hemophilia is a medical condition that reduces the ability of blood to clot and can lead to an excess amount of bleeding, even from a small wound, such as Queen Victoria's son Leopold, who died at age 30 after a fall. The condition is caused by a lack of coagulation factor, most commonly factors 4 and 8. There are 3 types of hemophilia: A, B, and C. Type A, lack of blood clotting factor 8, is the most common type, making up of 85% of cases. Type B, also known as Christmas disease, lack blood clotting factor 4. Finally, we have type C, which lacks the blood clotting factor 11, known as 11. Hemophilia is a sex-linked genetic disease caused by a mutation in a gene on the X chromosome. This mutation predisposes males to a greater likelihood of contracting the disease, while carrier women can potentially show symptoms but are uncommon. It is extremely rare for females to have hemophilia, as her mother must be a carrier of the gene and her father must have hemophilia. Roughly 1/3 of the babies that develop the disease are the first in their family history of having the disease through random mutation. If you'll direct your attention to the graphic on the right side of the slide, you will see that the father does not have hemophilia while the mother is a carrier of the hemophilia gene. After completing a monohybrid test cross for the hemophilia gene, it can be observed that there is a 50% chance the sons will have hemophilia and a 50% chance the daughters will be a carrier of the hemophilia gene. To give some perspective on how long doctors have known about this disease, we put together a timeline. In 1803, Dr. John Conrad Otto first discovered hemophilia as a disease. Then, in 1828, Dr. Schnoline and his student, Friedrich Hopf, gave the first diagnosis of hemophilia, originally called hemorophilia. Finally, in the 1920s, factor 1 deficiency was first identified and described by medical experts. Then, in the 1940s, factor 2 and factor 5 were identified. In 1947, Dr. Alfredo Pawlowski distinguished that there were 2 unique types of hemophilia, types A and B, which were discussed earlier in this video. In the 1950s, rare factor deficiencies of 5, 10, 11, and 12 were recognized.
Hello everyone, I'll be taking over from here to discuss the molecular aspects of hemophilia. The F8 gene provides instructions for making a protein called coagulation factor 8. Coagulation factors are a group of related proteins that are essential for the formation of blood clots. After an injury, clots protect the body by sealing off damaged blood vessels and preventing further blood loss. The F8 gene is located towards the distal end of the long arm of the X chromosome at position XQ28 and is 186 kilobits of genomic DNA in length, and consists of 26 exons that encode a 2351 amino acid precursor polypeptide. While there have been a significant number of mutations that have caused hemophilia, ranging from point mutations, missense mutations, and nonsense mutations. The most common mutation is the inversion of intron 22, which accounts for 40 to 50% of patients, and intron 1 inversion of the F8 gene accounts for 5 to 7% of all hemophilia cases. Detecting hemophilia is done through multiple tests, including coagulation factor assays, targeted genetic testing, or mutation scanning and sequence analysis. Coagulation factor assays tests for the range of clotting factor activity present in the blood. The normal factor 8 clotting activity is 50 to 150%. In hemophilia A, the clotting activity is 30 to 40% or lower, with the lower the value the more severe the case. Clotting factor levels of 5 to 40% is considered mild. A moderate case of hemophilia A has clotting factors ranging from 1 to 5%, and clotting factors less than 1% is considered to be severe. Targeted genetic testing includes using polymerase chain reaction testing for the inversion of intron 22 and inversion of intron 1 respectively. Where factor 8 intron 22 inversion is described in almost half of families that exhibit severe hemophilia A. Mutation scanning or sequence analysis is used to the type of mutation responsible for the disease in that individual or family line. In severe cases of hemophilia A, large gene alterations including deletions, insertions, frame shift and split disjunctions, missense and nonsense mutations, are responsible for about 50% of mutations. In mild to moderate cases, the most common mutations leading to the disease are missense mutations in exons coding for 3A domains or 2C domains. Looking at the graphic provided, you can see the difference between a normal and wild-type allele for the F8 gene. Queen Victoria of England developed a spontaneous mutation for hemophilia B. She later passed the trait on to 3 of her 9 children, her son Leopold, and daughters Alice and Beatrice. Both Alice and Beatrice passed the genetic disease on to several of their children. Alice's daughter, Alex, married Tsar Nicholas of Russia, who then passed hemophilia on to their son, Alexei. Hemophilia. The genetic disease remained in the royal bloodline for 3 generations, then disappeared.
In order to be diagnosed with hemophilia, a medical worker will have to test your blood. The symptoms of this disease all deal with bleeding of some sort in or out of the body. Bleeding in the joints is a symptom which creates swelling, pain, and/or tightness in the joints affecting the knees, elbows, and ankles. A lot of symptoms can go undetected until physical action is taken, like bruising, nosebleeds that are hard to stop, and bleeding after getting vaccinated. Infants have their own symptoms, for example if a male baby is getting circumcised afterwards, if bleeding is continued, and bleeding in the head of an infant after a tedious delivery. 1 in every 5,000 male births are diagnosed with hemophilia. It is presumed that there are between 20,000 to 33,000 males in the United States living with hemophilia. It is likely that there are significantly more men with the disease. Hemophilia A is over 4 times more common than type B, and while hemophilia has been shown to occur more often in Caucasians, hemophilia occurs across all race demographics. For research purposes, we have primarily focused on hemophilia type A in this video. You may ask what the options are for treating hemophilia. Replacement therapy is one of the biggest ways of how hemophilia is treated. Replacement therapy is taking concentrates of the clotting factor 8 or 9 that are dripped or can be injected into the vein. These concentrates are made up of human blood, but there are others that are not made from human blood that are available to children. There are downsides of replacement therapy, like developing antibodies that could potentially attack the clotting factor and developing viral infections from the human clotting factors. Like the symptoms where this affects your joints, a complication of this therapy is muscle, joint, and other body parts, resulting from delays in the treatments. Hemophilia is likely to become the first widespread severe genetic condition to be cured by gene therapy. There are currently 2 ongoing studies of GenStar based on the peripheral vein injection of a minimal, gutted, adenovirus containing a full-length cDNA and with an albumin promoter so it can drive liver-specific expression. The first trial in hemophilia that the transgene has been specifically targeting a particular tissue and first in any disease of a gutted adenoviral vector. In the first patient of this trial was HCV uninfected and had a normal liver function, but the trial was stopped because he developed a systemic side effects like fever, moderate thrombocytopenia, and impairment of liver function tests.
Hemophilia is not just a classical monogenic disorder with complete penetrance, but is also classified in a space that marks a conceptual continuum of Mendelian to complex diseases. Hemophilia is a quasi-quantitative condition with variable expressivity, with the allelic spectrum encompassing mutations that show least phenotypic variation as well as those showing phenotypic plasticity. Hemophilia is the inability of the blood to produce clotting factors through the suppression of multiple clotting factors, the most common being the suppression of factor 8. Hemophilia has been ravaging many family trees for centuries, with the most popular case being through Queen Victoria's family line for 3 generations. There are varying symptoms, but all include excessive bleeding from minor injuries and frequent nosebleeds. Thankfully, through genetic testing and gene therapy work, hemophilia is likely to be the first genetic disease cured.